Hi, I'm Heidi Nelson, CEO at Duffy Health Center, and welcome to Duffy Doings, our show about healthcare and homelessness on Cape Cod and what's going on at Duffy Health Center. Today we're going to talk about cold weather and the response that we have, a coordinated response here on Cape Cod for people who are homeless to try to help them stay out of the cold. With me today, my guests are Paula Schnepp, who is the coordinator of the Regional Network on Homelessness. Welcome, Paula.
Thank you.
And Pat Cawley from Duffy Health Center. Pat is the Senior Director of Program Services, so she's over our behavioral health programs and our case management programs. Welcome, Pat.
Thank you, Heidi.
So we knew it was going to be a tough winter this winter. The Farmer's Almanac predicted that it was going to be a cold and snowy winter, and we have not been disappointed. We've had a deep freeze kind of right at the beginning of the winter, and cold and blowing wind, and a lot of difficulty being outside. So imagine not having a place to stay. Imagine being homeless and being caught out in the cold. Last month in December, we had our Homeless Memorial Day, where we recognized individuals who passed away in 2017 who had significant experience with homelessness, people who were homeless when they passed away, or people who had had significant homelessness that really affected their health and affected their lives. I like to say often that homelessness causes poor health, and poor health causes homelessness. Many studies over the years have shown that death rates for people who are experiencing homelessness are much higher than they are for the housed population. Fortunately, on Cape Cod, we have strong ongoing partnerships between homeless service organizations and between those organizations and local and state government, and in particular law enforcement in our towns. And this year, those partnerships have been a really critical component in our cold weather response. So Paula, maybe we'll start with you. Can you talk about these partnerships and how the partnerships were really important this year in making sure that people who are experiencing homelessness were not left out in the cold during these terrible cold spells that we've experienced recently?
Sure. So we do have a shelter for homeless individuals, and that shelter, now named St. Joseph's, is located in Hyannis, and it has a capacity of 50 people. But with the cold weather, some of those folks that managed to tough it out in very cold temperatures really needed to be inside. And so the shelter was able to expand into an overflow capacity of an additional 10. Unfortunately, the demand was even greater than that. So
more than 60 people a night.
More than 60 people, yes, absolutely. And although we also, as a region, try to get people out of homelessness, the shelter, into housing, sometimes there's obviously a timing lag, and so we need to address the immediate need of those who might be in the cold. We had many conversations as the temperatures plummeted and the problem was identified, but in the beginning of this year, we convened a much larger meeting and brought in partners that sometimes are not at the table. So we brought in Red Cross, Council of Churches, VinFin, which is one of our mental health providers, obviously Duffy is a party, Housing Assistance Corporation, the county was there, represented by the Human Services Department, and the CCIT team of the Barnstable Police. That's the Community Impact Team, and they work very effectively during the entire year trying to meet the needs of people who might be outside. So we convened and discussed options, everything from trying to identify yet another additional overflow shelter, or to look to an existing program, which we will be talking about more in depth, that has helped people in the past and from the streets. And the consensus at the end of our meeting was to really support the efforts of In From the Streets, where individuals would be triaged and then put into suitable accommodations during the cold weather.
So the CCIT, that's part of the Barnstable Police Department, is unique on the Cape, and what's interesting, through a state-funded grant, they've received additional training, and now they're actually able to train other police officers across the Cape. And we've had some of the officers on our show before, but they have a goal to train. There's a shorter training called Mental Health First Aid. Their goal is to have 100% of the police officers on Cape Cod all trained in mental health first aid, and about 20% then to get the CCIT training, which is a 40-hour training, which is really intensively looking at how to work with people with serious mental illness and drug and alcohol issues, to provide a compassionate response as opposed to the carrot instead of the stick, I guess would be a way to say it. So it's been a fabulous partnership between the service organizations and the police. So, Pat, talk about the homeless service providers and the people that they have working directly with the people who are experiencing homelessness, and when we can anticipate that it's going to be bad weather, a hurricane is coming, or we have cold weather, how do they work together, and what kinds of accommodations do we find for people?
Actually, unfortunately, we put it into practice today. We went into cold weather alert because it's going down to 18, I believe, tonight. There's a group of outreach workers from the different agencies who work very closely together. Duffy has a couple. We work with Housing Assistance Corporation, VinFen, the team from the DMH, the contract, the HOT team.
Department of Mental Health from the state.
Thank you. Yes, the Barnstable Police Department, who identify people who are out in the street that might need shelter. We do an assessment with the folks to see, is there somebody they can stay with for a couple of nights? And sometimes that works, to see who can they beg to maybe stay there, or, to go back home or do something like that. So some people get housed that way. Otherwise, we put them in temporary places, hotels or motels, just to save lives. I mean, we often use this grant for other reasons too, but for cold weather, the plan is just to get people in from the cold and have them be safe.
Can you give an example of how one of our outreach workers has worked with a client to get them in off the street?
I actually have two. There was one woman who struggled with addiction for years. She's lived from all over the Cape, is well known to human service agencies, but could just never get it together. She finally got into our medication-assisted treatment program, which was helping her with her addiction. She was not able to go to St. Joseph's because of past behavior. So in the cold, we were able to put her up into the hotel. She's now at St. Joseph's.
Oh,
so
great.
She's there, so she's getting the services there, so she's working on a housing plan, and she's sober. And she has so much energy right now. She's helping out everywhere she goes.
Very good, very good. So people do get second chances if they can demonstrate that they're willing to follow the rules at the shelter.
Absolutely, yes. Then we have another gentleman who's about 60, 61 years old, lives outside, is known by all the police departments in all the towns, very mentally ill, not dangerous, wouldn't hurt a fly, but just does not want to be inside. We went out looking for him, and the teams did, and got him in, so he's going to be in again tonight. Because people are concerned, they know the most vulnerable people in the homeless community, and so that outreach team goes and looks, asks other people who are experiencing homelessness, have you seen so-and-so, how can we get them and get them inside? So he's just going to be safe. I don't know that we're going to have the happy ending to this story yet, but it's always a time to plant seeds, working with somebody to try and build that relationship up with them.
And when we can demonstrate a compassionate response that helps to helps with engagement with the clients, so that when maybe they do make a decision that they don't want to be homeless anymore, maybe that's the first person they'll go to. Is the person who helped them out that night that it was really cold. So a big part of this response is a program called In From the Streets. And it's a program that was started more than 10 years ago. Duffy Health Center is the fiscal agent, meaning that we hold the dollars and we kind of manage the program, but it really is a community-wide program. The base funding for the program comes from the United Way, and that's a really important way that small businesses and businesses across Cape Cod, who are the major donors to the United Way, can participate in homelessness funding and ending homelessness on Cape Cod. But then once we have the base funding, we go to each of the towns with a request, and the United Way funding is anywhere from $8,000 to $12,000, and we generally get $1,000, $2,000, sometimes as much as $5,000 from the various towns to match, if you will, that $12,000. So what we're really, and there are some individual donations and some foundation donations that go into In From the Streets. So one of the reasons why we're doing the show right now in the wintertime is that because it has been so cold, we've really depleted those resources, and for the benefit of the entire community, and all the towns across the Cape have the ability to access these resources. So can you say what's the process for making a donation to In From the Streets?
Okay. You can write a check to Duffy Health Center, 94 Main Street, Hyannis, Mass. 02601, or you can go to our website, duffyhealthcenter.org, and we have a Donate Here button that you can just click, and we'll explain to you how to make a donation.
Very good, very good, and we'll repeat that at the end of the show. So we talked a little bit about, it's kind of Hyannis focused, but Paula, do you want to add anything about the other organizations that serve the homeless across the Cape?
Sure, and actually Cape and Islands. Our
Cape
regional
and Islands
network actually covers Martha's Vineyard and Nantucket, in addition to all 15 towns on Cape Cod. And in fact, when the temperatures did plummet, we were making outreach to our contacts in Falmouth, Martha's Vineyard, in Orleans, and the Lower Cape to see if they had adequate resources to respond to people who might be out in the streets. And
right, so Homeless Prevention Council, which is an organization on the Lower Cape, Lower and Outer Cape.
Serves the 8 towns of the Lower and Outer Cape.
So. Right, so they're an active participant and able to access the In From the Streets funding. So Paula, tell us about the Regional Network on Homelessness. What is it, and who are the leaders of the Regional Network?
So it's been in existence in some configuration for over 20 years, but it came into its current configuration in 2009 when the state provided significant funding to address homelessness in our communities, both for families and individuals. And based on that, we were able to hire a coordinator, provide funding for families and individuals to prevent their homelessness or get quickly into housing. And even though that funding slipped away after about 2 years, the value of our convening is very important. The second, and one of those valuable things is Barnstable County Department of Human Services is actually the convening agency of the regional network, and they are now what's called the collaborative applicant for our HUD, that's Department of Housing and Urban Development, COC, Continuum of Care, where we receive close to $1.6 million of funding to provide permanent supportive housing. So again, this response we're discussing today is very much that initial engagement and making people safe, but the ideal is to get people off the streets and into their own housing.
Right, right. And I know that there's a policy board and then there's an executive committee.
Yes.
So who makes up those different bodies?
So the policy board has about a membership of over 30 people, and we have representatives from various towns and state agencies and local providers of both housing and human services. So getting complete representation. We actually have a woman who is the homeless liaison for Barnstable Schools, so she can share her perspective of homeless families and homeless kids. So we're trying to get a broad view of the risks of homelessness and ways to address it.
Well, and another thing I'm known to say frequently is that homelessness is really the end result of every social problem that we have in our society, and so you have to have people from a variety of sectors and order to be able to address the problem holistically, that's for sure. So what are some of the current initiatives of the regional network?
So on Tuesday of next week, we will be holding our annual point-in-time count. And again, this is required by our funder, HUD, to survey all those households that are experiencing homelessness within a 24-hour period. And tracking the households that are in shelter is relatively easy because they're put into a database and we can just aggregate that information. But our count of those who are unsheltered, the very population that we're talking about today, is always a little bit more difficult because trying to find people who are out in the cold is not always easy. But we've come up with a methodology that we feel pretty confident about, that we are able to find people who are unsheltered on the night of the count, and we're working with agencies across the entire Cape for them to also document any households that they come in contact with that were homeless on the night of the count.
Right, so lots of agency involvement,
Absolutely.
Lots of different players and volunteers who are going to be fanning out to do that counting. You all work together on something called the coordinated entry system, and we've had a show on that before, but just briefly, how is that going?
I think it's actually up and running in a way that it's working. Very, in the terms of how it was supposed to be designed. Again, we got very detailed requirements from HUD on what a coordinated entry system is supposed to include, which actually yesterday was the deadline to meet several of those requirements. What it has done is provide a challenge for all of us because we need to identify those who are most vulnerable.
Can you say what it is briefly, what a coordinated entry system is?
The coordinated entry system, the best way to think about it, it's a waiting list. So who gets...
But it's everybody.
Yes.
And instead of having individual agency
we have
waiting
different
lists.
programs that are managed by different agencies. But since last year, anybody who gets placed in those vacancies in those programs has to come through the coordinated entry system. So it's having a master waiting list. And we spent a lot of time developing the authorization forms for this and the process and the security issues. So I think all of that works well. And I think we've matured to a point where we're really trying to make sure that there aren't a lot of how do I say it, unnecessary wait times for people to actually get from the list into housing.
Right. And how does it work from the provider side, Pat?
The case manager completes an assessment on the client, and that scores the person according to their vulnerability and what their priority is and what type of housing would be best for them. That score goes into the central waiting list. And then when we have an opening, we are securely sent that information, and we contact the client and also the agency that was working with that person, and then work with them to get them into one of our housing units.
So a great example of, again, another example of how we collaborate and coordinate on the Cape. And then we had a meeting the other day to talk about a new kind of collaboration, which is at the information technology level, data warehouse. What's that all about, Paula?
Well, we hope it's a real positive move because we do a lot of data collection, but it's never very useful to those of us who are managing the programs. It kind of gets sent up and disappears. So the whole goal is that if you participate in this warehouse, you will be uploading the data that you have gathered regarding the population you're serving, and then that will be aggregated and able to be viewed by other agencies across the state. And we will also have that view. The advantage there is when we're trying to serve somebody with federal dollars, we have to document the length of time in which they've been homeless so that we can determine whether they're considered chronically homeless. And that's often very difficult to do, just by the nature of a person who's been homeless for years.
And chronically homeless then kind of prioritizes those folks for access to resources because we want to focus our resources on the most needy.
Right. But to document that someone meets those criteria is challenging and sometimes is a barrier for people to get into housing. So the hope is that if we can share data, those who may have had other periods of homelessness, we'll have a better access to that information. That's just one. We also heard recently that the EA, that's Emergency Assistance, which is the family homelessness system that the state runs, will also be available to us. And again, we have not had real-time or current information on the experience of our families who are experiencing homelessness.
Right. So, and the state, interestingly, is providing resources to the local groups that are working, the local regional networks, to provide the resources to be able to participate in this system. So it's good to see government encouraging us to work together, but then also providing the resources. So it's not an unfunded mandate in this particular time frame.
That's true.
So thanks for that. So it's going to be very exciting, I think, both on the service side, but also on the system side to have data on those two levels. So what's going on in the case management department, Pat?
Well, lots. We've talked a little bit about our outreach case managers. They're the case managers who work with people who are still living out in the streets. As we said earlier, they work very closely with the other agencies so that we can really coordinate people's care. One of the programs we have at Duffy is called the shower program, where a few days a week, if somebody's out on the street, they can come in to Duffy and shower. And we use this as not only to help them get clean clothing and a shower, but it's an engagement tool. Somebody may come in, not want to see anybody in medical, behavioral health, or even talk about anything, but they'll come in for a shower and maybe get a candy bar, a little juice drink to go. So it's those little baby steps to really work with people. So the outreach work is identify people who are out on the street and help them get services. Oftentimes it's detox they need, or substance abuse treatment, mental health treatment, in addition to housing. We have some case managers that have the title Recovery Support Navigator, and they are people who are in recovery themselves, and they're working with our clients who also are struggling with addiction issues. Their work is incredibly successful because they can engage with our clients as a peer, whereas other professionals are treating them, but this is really somebody who understands, who's been there, has done it, and knows what somebody's going through, and comes at it with a different lens. So that program's working very well.
And this is another model that the state is really, and nationally, looking at the value of having people who have lived experience and what they can share with people who are in the throes of trying to make decisions about whether or not they want to go into treatment, and then trying to support them through. There is a light at the end of the tunnel. Look at me, how well I'm doing. And so that's really valuable and very important. So another thing that we're dealing with is system transformation in healthcare. And again, the state is transforming the way that the Medicaid program works here, or Mass Health as we call it in Massachusetts, which is really, instead of financing or funding insurance companies that we call managed care organizations, or HMOs, the hated HMOs, and shifting to now funding networks of providers and having those dollars go to the providers to determine what's the best way to keep that person healthy, or to treat their illness, or improve their lives, improve their health, and improve their quality of life. And what's really exciting to me is that there's a whole new focus on social determinants of health. So do you want to talk about that a bit?
Sure. Again, it's going back to hierarchy of needs. If people don't have food, a place to rest their head, their health isn't going to be high on what they're going to do that day. So I think the healthcare system is now looking at how do we help people meet those needs so that they can get their health goals met. There's a lot of research out that identifies certain chronic diseases with anxiety and depression, and those go hand in hand. And if we can't help somebody with their depression, oftentimes that's not going to help them with their diabetes. They're not going to be able to be in control of their diabetes, make the right choices around that. So the way that we'll be doing healthcare in the future is for people to be assessed just as you would for a physical. Now it's going to be for your social needs and what's going on with you. If you don't have transportation, you're not going to be able to bring your child to the pediatrician. So the pediatrician's office might be calling somebody non-compliant, But if a young mother has 3 children and can't,
The car's busted.
exactly.
Yeah.
Or how do you,
Yeah.
take public transportation with 3 babies and all of that? So to really identify what those issues are, to even the playing field, so that people can get the health care that they need. So I think it's a very exciting time for us. I mean,
Well, and the other piece of it is through identifying the needs of the people in a systematic way, we're gathering a lot of data that could feed into, what are the housing needs, what are the needs for domestic violence services, what are, I mean, one of the things that we talk about a lot in our development, and where Duffy is partnering with Outer Cape Health Services and Cape Cod Healthcare in this system transformation. And one of the things that we get a little nervous about is, well, if we're asking all these questions about what are your issues and your problems, then we have to be able to solve them.
Right.
So what are we going to do? But what I found really fascinating is that when we met with Steward, who is the big system that we're going to be relating to in our area, the person who's assigned to us came to visit the Cape and came to visit Duffy Health Center, and she just absolutely had stars in her eyes. She said, "You guys really do something about homelessness." Because they know when they look at Medicaid data that the people, there is a way to code when you're providing services to a Medicaid patient that they're homeless. And so they can actually look into their data and see that many times people who are homeless are very high cost from the perspective of the Medicaid system. So if they can partner with agencies that know how to not solve that problem completely, we know the answers, we just need to have the resources, right? And we have the skills and the abilities to kind of address that. So that's very exciting. She said, "You do housing? I can't, I can't wait to start working with you." So that's very exciting. Well, I think we've run out of time.
Okay.
So it's just been a pleasure to talk with you today about all of this. And let's see, we have to say the donation, where you send a donation for In From the Streets, care of Duffy Health, In From the Streets, care of Duffy Health Center. You can send a physical check to us at Duffy Health Center at 94 Main Street in Hyannis, and that's 02601. Or you can go on our website, duffyhealthcenter.org, and there's a big button on the homepage that says Donate Now. And when you make a donation electronically, you'll be able to write somewhere that you want this to go to the In From the Streets program. And we'd be so grateful if you would make the effort to make those donations. So thank you again, Paula Schnepp, who's the coordinator of the Regional Network on Homelessness for Cape Cod and the Islands, and Pat Cawley, Senior Director of Program Services for Duffy Health Center.
Thank you, Heidi.
And that's it for today's episode of Duffy Doings. Please join us next time.